Day. Now, World Health Day is celebrated by the World Health Organization to commemorate the day that they began, the day they were officially launched. And now this is many, many years ago. I don't want to get the year wrong, but I'll be giving you that year very shortly. But the reason why I brought this up now is because we have representatives of MedPlus in the studio with us. We have Deoye and Dami. Welcome to the show.
Thank you
so much for having us.
World Health Day.
Yeah.
Goodness me. Okay, so I think when it comes to branding and chains of stores, MedPlus has, of course, given us over the years a sense of confidence and trust. And we've been able to, anticipate that if you walk, probably not walk, maybe drive, maybe 1 kilometer, you will find a MedPlus.
Yeah.
Which means that I've sort of got more control over maybe if my kids need some kind of medication. I have that confidence that you are there to provide it for me. So for World Health Day, what is MedPlus doing?
All right, thank you very, very much. Yes, like you said, it's World Health Day, and the theme for this year's World Health Day is My Health, My Right. It's primarily about, should I say, having conversations around access to healthcare to everyone, everywhere. So putting press on all the relevant stakeholders, and I must say, MedPlus, we're happy to be part of the conversation. Primarily, like I mentioned, we're trying to drive access and drive this sense of consciousness into everybody. Yes, we know that we're putting press on the stakeholders, but we also as individuals have to take that right and be conscious of it to actually drive our own health and put the right contributions to have a good health.
I appreciate that answer. We have to take a quick break, but there's still so much more to this conversation coming your way. Now, over the weekend, the world celebrated World Health Day. And in the studio with us, we have representatives of MedPlus here to talk to us about exactly what they have planned for this special commemoration. Welcome to the studio, Dami and Deoye.
Deoye, yes, thank you.
Welcome.
Thank you so much.
All right, so I want to just go straight to you, Dami. What are the plans that the organization have for this celebration?
Okay, thank you so much, Titi. Even before the World Health Day, what we normally do at MedPlus is we do free medical checks. Okay. So we have the conscious effort to impact the community that we reside in. Yeah. We call that CSR. So it's not just about making money. It's not just about being the market leader. We want to impact positively in our community. So we have different outreaches that we've done. Earlier this year, we went to Shogoro community, where we gave free medical checks, free drugs to the children of that community. Okay. We're actually coming to TVC as well. Okay. I'm excited about that one.
When is that?
When is that? 19th of April.
Oh, okay.
Yeah,
okay.
So we are...
make sure I'm here.
Okay. Yeah, so we check your vitals, we give free consultation. I know Evan was telling me before we started that she gets us a skincare there. So yes, we're going to do beauty consultations as well. Possibly give a discount. Yeah, and yeah, that's just what makes us, top of mind.
Okay, so now I have to touch on that word you used. You said discount. Now you go to Money Matao. I want to talk a bit about the fact that, yes, you have instilled confidence in us that, yes, there is access to certain medication, in Lagos, in Nigeria. I know you have loads of branches all over Nigeria. But the cost of medication right now is skyrocketing like crazy. And I'm wondering, as a business, I know you are into business development, how have you been able to manage this based on the fact that you know that people come to you for essentially help? Yeah. So how have you been able to deal with this situation?
Okay, thank you very, very much. I mean, it's an issue we're all accustomed to. I mean, even if we don't get medications ourselves, we get for some of our loved ones. Yeah. And for MedPlus, what we try to do, understanding the current challenges we're facing, is to, from time to time, rejig our supply chain architecture. So we want to ensure that we get this medication at the best price, still sticking to quality. So, and from time to time, I mean, this price thing, the management of the company is always conscious of it. So we also, from time to time, check where we can also even take down some of, should I say, lose some of the margins so that we can even, should I say, work with people, because we know the times we are in. So we try to work on prices, we try to get the best pricing. We also try to also work on our brand dynamics, so that when you come to our store, almost everyone visiting our store can get something. Taking consideration maybe your budget. So if you have a budget for this amount, for any of the acute cases or even those on chronic care medication. So those are part of the initiatives we are doing. And like Damola mentioned earlier, we're also actively at the forefront of driving CSR events. So we know that not everybody will be able to come to MedPlus. But for those that are not able to come to our stores, we still take health care to them. So that is what...
So I want to touch on the theme just a little bit more. My health, my right.
Yes.
What exactly do you believe the World Health Organization is driving at there? Because there are still a lot of countries around the world that don't have access to health care. And I'm wondering how your organization wants to align with it.
I think it's basically in line with what we do. Like, it's very correct that it's your right to get access to healthcare. I mean, it's not just about working hard. You need to know that, okay, you're working hard, you're keeping fit and all of that. So this is why we do what we do in terms of give free medical care, at least do the minimum.
The barest minimum.
Yes. So you don't have to go to the bank, you don't have to break a bank to know what your blood pressure is saying, your BMI, your blood sugar, even malaria tests, you know, even down to chronic conditions like hepatitis, you know, all of that. And then we even have partnership with some of these hospitals that we can refer that you go to check all of these things. So yeah.
Okay. I'm wondering about the extent of what your pharmacist render as a service. My health, my right, right? Now, there are a lot of people that just don't like the idea of going to a hospital. And we know the culture here, people like to self-medicate. And I know that your organization has made sure that there are pharmacists inside every single branch. Now, where do you draw the line and, you know, insist that a customer maybe goes to the hospital when the pharmacist's job there is actually also sort of to give advice and maybe prevent maybe abuse of drugs? So talk to us about that.
All right. So one, every MedPlus store is equipped to offer to people services around the primary health care setting. So you have acute cases like basic ailments like malaria, like minor infections. So we have pharmacists that are trained to identify and actually manage those healthcare issues. But as pharmacists and healthcare professionals, we know that there are certain pointers you see in a person. You are able to pick it there and say that, sir and ma, at this point, you need to actually go to the hospital. You need to take this charge for this and this that I am seeing. And as well, our team also engage every of our customers around things that can help us improve our healthcare. We offer services like weight management. We educate our customers on dietary and lifestyle management. We offer vaccination. That's one of the big things, we're doing this period. Yes. Because we understand the benefit of preventive health. We know that if we try to vaccinate just an individual, we probably are saving like ×4, ×5 when you consider the healthcare body in terms of the economics. So we're actually pushing that message so that we actually drive holistic healthcare. We also have supplement of different ranges.
I was actually going to touch on that. I think you have something you wanted to talk about in that particular area, right?
Yeah. So a bit on supplements. Basically, supplements they either come as macro or micro. Now, the macro are our everyday carbohydrates, fats, and proteins. The micro are those the body needs that will probably miss in our diet. And so we have supplements that are tailored to actually address those healthcare needs. We have those that caters to the general well-being. I don't know if I can mention brand. Okay, we have our Revive Active, for instance, that actually helps to improve the heart health. So if a typical heart will last for, let me say, about 70 years, maybe based on how the person has used the heart. When you start a supplement like this, it reduces the workload on the heart,
Wow. Okay.
providing it the essential vitamins and minerals so that the veins and, those vessels carrying the blood, rather than being straight all the time, they're a bit more relaxed. And so the work the heart is doing to pump blood across all the vessels is actually lessened. We have a beauty
Revive,
complex.
right?
Yes.
Revive Active.
Yeah.
And
Has
there's a
different range.
beauty complex. But as soon as someone walks into a MedPlus branch, they can get more information about this supplement.
Exactly. Sure.
Right then.
Sure.
And I believe you have it on your website as well?
We do very well.
All right then. Thank you so much
We are
for
grateful.
coming to talk to us.
Right.
And of course, happy World Health Day.
Thank you
you.
so much. Thank you.
Have you done a health check recently? If you haven't, you can walk into a MedPlus near you and get a free check. Did you know that? Well, you heard it here first on Wake Up Nigeria. Stay with us. Let's take a quick break.